Thank you to Insight for generously sponsoring this episode of Dermatology Undressed, a provocative podcast. Insight had no influence on the selection of the faculty nor content development. This podcast is for educational purposes only and is not medical advice. For personal medical care, please consult a qualified healthcare professional. Welcome to Dermatology Undressed, a provocative podcast, where we peel back both the skin and the story to reveal the truths about health, medicine, and humanity. I'm Dr. Lindsay Ackerman. I'm so overjoyed today to be joined by Dr. Peter Leo, a trailblazer in medical dermatology. Dr. Peter Leo is a clinical associate professor at the Northwestern Feinberg School of Medicine in both dermatology and pediatrics, and has been an absolute leader in integrative dermatology, complementary approaches to the way that we manage patients with chronic inflammatory diseases within dermatology, approaching complex issues with sometimes quite simplistic interventions. Thank you so much for being here today, Dr. Peter Leo.
Thank you so much for having me.
Thank you for all of the work you've done for the entirety of your career. I have admired you from afar, both close and afar, but I find it particularly interesting that your career path took you down this niche where you were able to take the best of all of our conventional therapies and yet be holistic in your approach to patient care that allowed your mind and practice to be open to using alternative therapies as well. We all know that a lot of our patients come into the office asking us these questions: what works, what doesn't, what's potentially even harmful. So I'd like to just open it up to you first and ask, how did you find this path? How did this become of interest to you?
It's one of those funny things where my whole life I've always been interested in fringe things. When I was a little kid, I was reading the encyclopedia about the Loch Ness Monster and Bigfoot and UFOs. So I love the fringe. I like the cutting edge because to me, that's sort of where all the exciting stuff is happening. And I knew I wanted to be in medicine for a long time, but when I got to medical school, I quickly realized that we didn't really get to go to the edge. There was so much basic conventional stuff we had to cover that I was kind of wondering, what about the patients who ask about acupuncture? What about homeopathy? What about these other remedies? Why don't we get to a chapter on that? There was no chapter. And in between the summer of the first and second year, that summer, I got to spend time with David Eisenberg, who at that time was really one of the national leaders in this movement. He had actually been one of the first U.S. students from medical school to spend time in China, and he learned traditional Chinese medicine a little bit. He had exposure to it and acupuncture, and then he kind of brought that back. And a guy named Ted Kapchuk, who wrote a wonderful book called The Web That Has No Weaver. So I got to spend a little bit of time with them and learn from them. And then that just kept evolving and developing. And before you knew it, I was kind of like Fox Mulder from the X-Files. When something weird came up, my classmates were like, ask Peter, he might know about this crazy stuff.
I mean, it's phenomenal because all of us are sort of grappling with not just understanding the physiology behind disease, but how do we find the best treatment for every given patient that we encounter? And we all know every human is their own physiology project, right? It really is. It's an individualized approach that must be respected. And not every conventional therapy is right for every person. But more and more what I'm learning is as advanced as our treatments have become, and they have become, I mean, you and I have lived this evolution. It's mind-boggling actually to think where we've come with our conventional prescriptive therapies and how effective they can be for patients. But I think now more than ever, our patients are still asking, well, what if I don't want to try a prescription? Is there something else that you could recommend? So I kind of want to throw it out there and say, what of all things do you think patients are asking for or asking about? Is it, am I eating something wrong, doc? Or is there really a gut-skin connection? Or should I be putting beef tallow on my face? That's been popularized of late. What do you find your patients that come to you for this integrative care really asking about these days?
No, I think that's exactly the right question because it comes from the patients generally. So when I talk to a more skeptical group of physicians or clinicians, I'll often preface it by saying, you might not be interested in this, but your patients are. And I think they often will perk up and say, all right, you're right. Patients ask me about this kind of stuff all the time. And if you look at the reason why, what is the driving factor? Because you're right, conventional medicine, we have so much knowledge. We have so many new concepts and ideas and great treatments, and we understand all about cytokines and neural pathways. Like, why would we need to go outside? But I think the truth is there are some fundamental things we still don't do for everybody. We do for some diseases. We've treated a lot of things. We've eradicated some terrible diseases, which is a triumph. And I would never belittle that, right?
Absolutely. And we must at least acknowledge the progress we have made in the science of medicine and respect what we're capable of doing. I think that deserves its own, call out for sure.
Absolutely.
But not in the absence of an approach that's considered holistic.
Right. And even with conventional treatments, if a patient asks you, why is this happening to me? Our answers aren't always that compelling, right? Well, there's a genetic component and maybe some environmental piece and there's some imbalance, but that can be unsatisfying. Patients also want a cure. Can you cure this? Well, in dermatology, especially medical inflammatory stuff, we don't really cure that much, unfortunately, yet. Yeah. So we're often managing. And I think those kinds of things. And then the last piece you bring up, can we do it in a more natural way, a more holistic way? And it's like, well, not exactly this chemical or this compound and this drug. That's kind of what we have. So I think those are areas of unmet need, especially when we're trying to personalize or get that precision care for an individual patient.
Yeah. And it's sort of like if you think back far enough on the things that we used to rely on when we didn't have such excellent pharmaceuticals to, abate inflammation, to mitigate itch, to do all the things we're able to do today. You go back to some of those other therapies, they weren't terrible. I mean, they did do something. And so, I think that a lot of our colleagues might question, well, is this really scientific? This seems kind of a little bit more on the, fringe or external to the fringe even. But I do believe that there's really some science behind a lot of the work that we're doing, or that I will say you've pioneered, that we now all sort of try to embrace in whatever way we can find it appropriate to the patient, that really stems back from years and years ago. And of course, the ancestry of Chinese medicine going back thousands and thousands of years. There's got to be some science to it. So tell me a little bit about where you kind of find the science in this equation, or is it more experiential for you?
I like it. And it makes me think of a quote that is probably falsely attributed to Confucius, like so many quotes, but it's something along the lines of, because the newer treatments are good, it does not follow that the old ones were bad. For if our worshipful and honorable ancestors had not recovered from their ailments, you and I would not be here today. And I like that idea that it couldn't have been that bad in the old days because we made it this far. And there is some wisdom. I think back about Paracelsus, kind of this iconoclastic, kind of originally from, Swiss is where he would be kind of nowadays, but really an iconoclast. And his big thing is he would push back against the academy, who was very stuffy about stuff. Mm-hmm. And he would say, you know what, I'm going to learn from the midwives. I'm going to learn from the local healers, because even if they don't have the same kind of science or the same kind of tradition or the same kind of trappings, they know some stuff. They're real clinicians.
They have experiential knowledge.
Knowledge.
Which you can't. You can't practice medicine and really be honest with yourself if you are saying that in some way you're not also practicing experience with your experiential knowledge. It guides so much of what we do. I want to actually go back to this kind of gut-skin connection suggestion that I mentioned a little bit ago. Tell me where you sit on this. Our patients will often say that let's talk atopic dermatitis, eczema. That's something a lot of patients can really understand. They've heard of eczema. They have itchy skin. They have barrier breakdown. And in fact, actually, this podcast itself, which is named Dermatology Undressed, a provocative podcast, is to be provocative. We're supposed to ask these questions, give some information that we think really is of value to these patients. So I hear a lot about, every time I think it's dairy. Every time I eat something with dairy, I think I flare. Or every time I'm exposed to gluten, right? Gluten might make me sick, and I've heard gluten's pro-inflammatory. Where does that stand in skin disease, in your opinion?
I think it is unfortunately kind of complicated, right? And I wish I could have like one clear dogmatic answer, like it's a bunch of baloney or it's totally the way. And I think the truth, like a lot of complex debates or situations, is that it's nuanced. And there is a role, though. The one thing I will say is that there definitely is a connection. When we think about it, I often will tell my patients, it's like skin and gut. They're literally connected. If you start tracing your face, go around your lips, now you're in your gut epithelium. And we know that the gut epithelium can be damaged and can be leaky, this concept of leaky gut. It's it's real. You can measure it. You can have people take, right, the different sugar combination and see what comes out in their urine. We know that leaky gut correlates with leaky skin, with skin barrier damage. So they're quite connected. What I get a little bit defensive is sometimes patients will say, well, it's all in the gut. It's only the gut. And I'm like, well, definitely it's not, because look at your skin. You're here to me today because your skin is causing you trouble. So at the very least, it's both. But I think we have to think about first of all, the holistic unit of the patient, right? These are all interconnected systems. And if there's dysbiosis and imbalance in the microbiome in one area, there often is an imbalance in other areas. So we have to think about it this way.
Yeah, and I first heard this introduced by you a couple of years ago, that actually, we have been so attentive to this gut microbiome, leaky gut syndrome for so long. And we in dermatology know about leaky barrier, right? Compromised barrier in atopic dermatitis or eczema. But when I first heard you speak about this 2 years ago, it really set an antenna off. And that was the barrier compromise in atopic dermatitis could be the sensitizer itself, right? Are there actually external proteins that are getting through our compromised barrier on the skin that in some way internalize and sensitize us, that also could then contribute to when that protein is exposed to our gut, creating an additional inflammatory reaction, creating worsening of leaky gut, et cetera. So there's this bidirectional, also communicative pathway that exists from the skin to the inside and from the gut inside to the outside. I find that fascinating. I also have had similar experiences where patients will claim, right, oh, I think it's really, really, this with my diet or so forth. And, I'm not going to not believe them. I'm happy to walk the journey with them. And we might do a trial period where we exclude a particular food. Rarely do I find that the exclusion of a particular food type in and of itself is sufficient. Again, maybe it's a part of the equation, but not adequate to control wholly their skin barrier, skin disease problem. I guess one of the concerns I have with elimination diets in patients is obviously nutrition is key to skin health. And when patients go through broad swaths of elimination in their elimination diets, do we run the risk of actually creating a nutritionally deficient human? I mean, is that possible? And could that then actually make the skin disease worse?
Absolutely. I mean, and it's more than possible. I mean, I've really seen it, and especially pediatric derms, I think, mostly seen cases like this where the family keeps getting told the reason your baby has bad eczema is because of something in the diet. Now, with an adult, it's trickier because people cheat and they do their own thing. But with a baby, you really can control everything. So I've had families where they've changed the formula, gone to an elemental formula, and then gone to something like rice milk. Now, rice milk is an incomplete protein source, and the babies actually have kwashiorkor. I've seen babies failing to thrive. It's frightening.
And for our audience that may not know what kwashiorkor is, that is a true protein mineral malnutrition status where patients, babies can't keep up with their growth. They end up with ascites, which is fluid in the abdomen. They end up with hair that's not pigmented. It's a real debility. Really
sick, and it's scary. I mean, and sometimes I'll talk to the family. I'll say, listen, if you kill your child, they will not have atopic dermatitis, but neither of us wants that. Right? That is not the ideal way to cure this disease. No. We want to get the baby healthy again. So you're right. It can be taken too far. And even though those are fairly rare cases, they stand out. I mean, we remember those. Those are frightening moments. But the other piece is that the way we react to food is actually pretty complex, like a true food allergy, right? Think about somebody with a peanut allergy. If they have a peanut, their face blows up, they're vomiting, they can die, right? They can die of anaphylaxis. Well, that's clearly not what we're talking about for here. Are we talking about food-exacerbated eczema? Maybe. Sometimes people just say they don't feel well. We know some foods can just be inflammatory. I truly think that dairy for some people can just be a pro-inflammatory piece, and that's true. So, right?
And
so
we see that in acne, right? We do see in certain circumstances, even in psoriasis, another chronic inflammatory disease in skin, in dermatology, there are clearly foods that can lead to, disease exacerbation. The corollary of that, though, isn't always necessarily true. That elimination of the food, meaningfully reduces the burden of disease.
Bam. And that's it. So clearly I want people eating healthy. I want people eating less processed foods. I want people trying to do, frankly, I kind of tend towards a paleo diet, sort of unprocessed, right?
I was just going to ask you, which diet, if you had to choose one, would you say is the most anti-inflammatory? I agree. Paleo or Mediterranean, which I find just to be a little bit more palatable.
Yes.
But indeed, for those that are willing to do something and they want to, use quote unquote the sort of dietary approach, rather than elimination, let's look towards anti-inflammation.
I love it. And from one of the Michael Pollan books, might have been In Defense of Food, eat food, meaning real food, not too much, mostly plants. I'm like, that's a win-win.
Yeah, absolutely. Can't lose that way. it's like you teach your children to make good decisions, right? It's the same sort of thing, right? We should be making good decisions. Okay, I'm going to shift a little bit away from, gut, microbiome, food, and go to stress, anxiety, sleeplessness. I mean, the reality is, and we've probably said this for decades. I think, in fact, Billy Joel, we didn't start the fire, but it does sort of feel like the world is on fire. Tell me how you think this is impacting our patient population. Are kids being impacted now as much with stress and anxiety? And we know scientifically that there is a rationale, a molecular physiology behind stress and anxiety driving inflammation in the body. Are you seeing that across both the populations you see and treat, pediatrics and adults? And in what way is this actually leading to, or is it leading to worsening of disease?
I think you're right on. More than ever before, I think modern life is incredibly stressful. We are constantly getting pinged with different things to try to take our attention. Of course, we know the screens make people in a state of persistent activation and focus that's really abnormal. That's not a normal human situation.
Cortisol is not supposed to be released at that frequency, right? For that many hours a day.
Totally. And then, of course, we know all these things affect sleep. People stay up late. They're looking at bright screens. They're obsessed with stuff. And then they don't sleep properly. And that, of course, fuels this whole stress cycle as well. So I truly believe, and it's not a cop-out. I mean, look, to some degree, everybody's under stress, especially, again, in the modern world. And not everybody has disease, fortunately. But there's no doubt we can see clear correlations when people are getting stressed about an upcoming exam for kids, or a divorce happening in a family, or a big life change. Their skin often, as you know, it showcases that stress in a horrible way.
Yeah. I am a not just believer, but a proponent and a communicator that your skin is this incredible window into what otherwise is going on the inside. And we can't deny that when we are under undue stress, our bodies are in this hyper-reg situation of chronic stimulation and sleeplessness and all of those things, that it shows. I mean, it really shows in inflammatory ways. Now, a lot of these diseases that we're talking about, eczema, atopic dermatitis, psoriasis, even acne, can be driven by sort of a genetic code to some extent, right? But the provocation on that genetic code, it's like the tempting of fate, is oftentimes layering stress on top of whatever that code is. Stress doesn't manifest the same way on skin in everyone. But if you're prone to having atopic dermatitis, you're prone to having psoriasis, and you're living a life of high stress, your disease is more difficult to control. It can certainly lead to flares.
Big time.
How do you approach the patients, with that? I have my own little tool set that I use. Obviously we have limited amounts of time with people. We can't sit and meditate with them for 30 minutes a visit, but
I wish we could.
Yeah, that'd be good for us too, right? But kind of just a tidbit for, our patient listeners who are maybe struggling and recognizing, listening to this, that, yeah, actually, my boss was a jerk. And every time my boss is a jerk, I seem to get more itchy. My eczema flares. Like, what are some take-home tidbits that you might be able to offer them?
I think it's so important because you're right. We don't have time necessarily to do too many things during a visit where we're also talking about other aspects and medicines. But I kind of like the Murakami quote where he says, pain is inevitable, suffering is optional. I can't take your stress out of your life, but I can help you deal with it, right? And we have tools. And so some of the mind-body techniques can be really helpful. I often refer patients to a hypnotherapist that I work closely with.
Wow.
And patients who roll their eyes like, wait, are they going to make me cluck like a chicken? It's like, no. This is like a guided relaxation meditation that she'll then give you a copy. You can listen to it anytime you want. So you can play it over and over again through your headphones whenever you need it. Incredibly powerful. We'll do things for kids and adolescents too. There's a whole set of things called habit reversal therapy, where we can kind of change some of these anxious behaviors that will often kickstart a whole set of responses and picking and pulling at skin. We can just change it to give them a replacement behavior. So all of these different little tools to help deal with it. I mean, of course, yeah.
I just want to pause real quick because this is actually really, really interesting. And I mean, think about what you do by giving a child, an adolescent, a tool that, today might be for their skin condition, but can serve them in life otherwise to help handle the, impact of stress on their life in adverse ways in the future. I mean, what a great tool.
It really is. I always tell the story. I had an older guy who had alopecia areata, and he
an autoimmune form of hair loss where hair is falling out in clumps.
Big time.
Broad
and
surfaces
stress
of hair
would trigger
loss.
a flare-up. So he'd be good for a while, and then all of a sudden he'd be under stress, and he had clumps falling out, and he'd come in with these, bald spots on his scalp. And he didn't really want to do any of the more powerful conventional treatments. We can use steroids, and we can use all these new powerful JAK inhibitors and so on. But he wanted something more holistic, more gentle. So we went with the botanical mixture of some essential oils where there actually is Actually, there are two studies now, an original study back from 1989, then a duplication of the study. They were able to replicate the findings, fabulous, in pediatric patients with this set of essential oils. And he did this for a number of months, had full regrowth, came back to see me. And I was like, this is fantastic. I'm like, you're all set. And he's like, no, I'm going to keep doing it. And I was like, oh, like you can, it's safe, but you don't have any hair loss right now. All your spots are back and you're great. And he's like, no, but it helps me sleep. It's my night ritual and I sleep so much better. And I think that's part of it. And I said, you know what? You're probably onto something.
You are probably right. This is where, the art of medicine, I find I have learned so much from just listening, right? Every day I hear something new from a patient that makes me think twice. Maybe I don't adopt, everything that I hear, but there you go, right? That's something you can learn and pass on to your next patient that who knows if it makes a difference. If it does, it's a win. Insight is redefining what's possible in biopharmaceutical innovation. Through deep scientific expertise and a relentless focus on patients, they have built an established portfolio of first-in-class medicines and an extensive portfolio of next-generation medicines across key franchises, hematology, oncology, and inflammation and autoimmunity, including dermatology. What I love about so many of these things that you've embraced over time, these alternative or complementary therapies to our conventional prescriptive therapies in inflammatory diseases of the skin, is that most of them really offer very little harm, right? I'd love for you to touch on a couple of them that I think, find most high yield in inflammatory skin conditions. I've heard you talk about black tea. I've heard you talk about hemp seeds, among many other things. But which are those that you think are most high yield? And then at the conclusion of that, I'd love for you to also touch base on a couple you've heard about that you actually think might be harmful. I think that's going to be important for our listeners.
Sure. You're absolutely right. And definitely some things we know more about, some things we have less evidence for. And I think we have a sense that some of these are probably more benign than others. One thing I'll just say for people that are more skeptical of this whole thing, I fully acknowledge that by promoting some of the alternative treatments, you can also stall somebody from going to something that we know is going to help. So very careful about that. That's why what I do, I talk about it as integrative dermatology. I'm not just going to do acupuncture on you or just going to give you an herbal thing. We're going to mix these things together. We're going to bring them together in a coordinated way.
And I want to piggyback on what you just said, because I think you hit something incredibly important. I want to get to your answer, but I don't want to not comment on this. And that is, we are medical doctors. We are trained in the allopathic, medical world. We are medical doctors, MDs. We took an oath called the Hippocratic Oath to do no harm. And I do genuinely believe that under treatment of disease is a form of harm. And so none of these things we are talking about today are necessarily to exclude the treatments that we have scientifically proven to create a tremendous amount of benefit. Because when you undertreat disease, you are, by definition, doing harm. That's not to say, though, that adding alternative or these integrative approaches, or sometimes allowing them to cover someone to wean off of conventional therapy, prescriptive therapy, couldn't be a phenomenal option, recognizing that there's always a role for both.
Exactly. I mean, if you are one of the lucky folks where cutting gluten has cured you and you're happy, fantastic. That's great for you. I'm not going to deny you that. But it's tough when you sort of try to impose that on a patient who's miserable and suffering and saying, well, maybe if I just do it longer, I'll get better. And maybe I don't have to do anything while they're falling apart.
Yeah. Yeah. So, sorry.
Some of my favorites.
I'd cut you off, but I want you to go back to some of your favorites.
A couple, I have a lot of different favorites, and I have so many, in fact, that what started out as an annual conference, we do our little Integrative Derm Symposium conference every year, which is really fun. We extended into a 9-month course because there is so much going on. But I'll tell you a few of my favorites. You mentioned the black tea compresses, and that is one of those things that has transformed my practice. There was a paper actually done in Germany. And in fact, the way I like to present it to my residents is I will take away what it is. I'll just show the charts and the graphs and the statistics. And I'm like, what do you guys think this is? Showing this incredible improvement in facial eczema score and in itch and all this kind of stuff. And they're like, well, I don't know. And they start thinking it's one of the new medicines.
Exactly.
And then I'm like, nope, it's just black tea.
Yeah.
And it's crazy. So in that study, they literally just had patients brew up a cup of tea, like Lipton black tea, whatever it is, plain old black tea. And then you can drink or pour out that first cup using the same tea bag, a gently used, so sort of the second steeping. And then I have my patients put that in the fridge. And so it's nice and cool. I don't want them to burn themselves. And then when it's nice and cool throughout the day, they can just take a soft cloth, dunk it in, and put that as a compress to areas of eczema on their face, on their body. Incredibly soothing, incredibly gentle. We don't really know why it works. It may be the tannins. It may be, who knows, the caffeine. It may be, I don't know, some other element of the camellia, but it really seems to help.
And this is, again, where we probably are grasping for something that our ancestors knew many, many years ago through their experiential practice, right? Who knows? This might have been something that was practiced hundreds of years ago that we're just now, sort of reinventing. But again, something that has very little to no harm. Again, cooling it, obviously of great import to not burn your face, but what a great win. And yet, probably needs a motivated patient who's not just looking to take a pill every day and walk out the door. Yeah, but for the right person.
Exactly.
How nice. How nice.
And kind of also low cost, very easy access for somebody that maybe can't get something more expensive, which I really like. Another thing that I use both in psoriasis and atopic dermatitis is topical indigo. So the indigo naturalis plant is really powerful, and you should see the science behind it is actually striking. They've done studies both in atopic derm and in psoriasis, and you can see the changes in the histology of the skin. The actual skin structure changes, the amount of scale changes, the pattern of the reedy ridges changes. It really is doing something.
So looking under the microscope, you're literally seeing structural differences in the skin that's been treated with indigo versus that which hasn't.
For real. And then they do a clinical part for these trials, and they really can show a good improvement. Now, is it going to replace a powerful systemic agent? Is it even going to replace a stronger topical steroid? No, probably not for most, but can it be an adjunctive treatment? Can it be something that maybe somebody milder could get away with alone? Yes, I can vouch for that. Or even my more severe patients might be able to go back and forth using something a little stronger for a bit, but then maybe they can step down to this more gentle piece to give their body a break.
Yeah. Where do people get indigo as a topical therapy?
So we have it made in small batches, and we can also have it sent to a compounding pharmacy because it's, the indigo naturalis powder is widely available, and we just have it put in a moisturizer base for our patients.
So listeners, ask your dermatologist to work with their friendly compounding pharmacy to compound your indigo topical. So you mentioned just a moment ago topical steroids. Topical steroids are the foundation of what we use to treat chronic inflammatory skin disease and have been for decades. There's a lot of, talk and chatter about topical steroids potentially causing some additional harm with withdrawal from those steroids, meaning when we try to get our patients off of the use of steroids, do they have some sort of rebound where they end up presenting with disease that was worse than the original disease? And then there's also this concept of, well, if my skin barrier is broken down and I put a steroid on there, am I absorbing the steroid through my body? Am I taking prednisone? If I'm an athlete, or am I going to test positive for steroid use if I've been using steroids on my skin? Speak to a little bit of that, if you would, please.
Yeah, so our steroids are very important in dermatology. They were kind of developed in the 1950s, and we know that they really did come from a natural place. I mean, they actually were using cow adrenal glands to get the cortisol derivatives. I mean, so in a way, it's a natural product that our bodies know exactly what to do with. And they're incredibly helpful. In fact, one of my teachers, Sam Michella, he was a wonderful teacher who passed away a few years ago. He told us stories. He was practicing before topical steroids were widely available.
I mean, that's hard to even imagine.
Right?
That's like brushing your teeth without toothpaste.
Literally.
Right?
We were like, what did you do, Dr. Michella? And he's like, we used a lot of petrolatum. We just used a lot of moisturizers. They didn't have much, but that transformed dermatology. That being said, like anything, right? With great power comes great responsibility. And we know there are known side effects that have been known from the very beginning. And then some that I think we're learning more about, like this TSW or topical steroid withdrawal syndrome. And I think, now a fairly decent size of my practice are people who are really concerned about this or actually have this. And there's not widespread acceptance of this entity yet, although I think it's coming because in the UK, it is now part of the warning on topical steroids.
Yeah.
And in Canada, it's now accepted. So I think we're getting there.
And, I don't know if it's human evolution or just the awareness of that this potentially exists, but I think I'm seeing more of it where patients were, they've been treated by somebody else. They're coming in, they're saying, all I've been given is a tub of this cream. It's a steroid cream for the past 5 years. I've used it here and there and everywhere for my eczema. But now every time I stop, it seems to come back worse. And my disease comes back worse. And I have to admit, I don't think 10 years ago, I was hearing patients say that. So I don't know what the source is, if there's something in our environment that's making us more susceptible to a lack of accommodation of our skin to the withdrawal or what the ultimate cause is. We as doctors don't know everything. We're good at pattern recognition, and this is a pattern that I've definitely been observing more and more of. Let me speak to something that I've, again, heard more of recently before we jump ship and go elsewhere with this conversation. I asked you to maybe comment on anything harmful. Beef tallow. This has gotten a tremendous amount of airspace on all things social media of late, past year or so. Can you comment on what you think of beef tallow as a therapeutic modality to treat inflammatory diseases in the skin?
Yes. I mean, I think, the beef tallow is really rich in lipids, so it is not a bad emollient, like just sort of to soften the skin and smooth it out. It doesn't really have any humectants or parts to hold the water in place once you put it on, and it doesn't have any protectant, so it doesn't seal anything. So I have a lot of families who do it, and depending on how it's processed, sometimes it smells like French fries. I feel like they walk in and it smells like you're at a fast food restaurant.
So you know what they've been putting on.
Oh, yes, I can tell while they pass me in the hallway. I'm like, I know what we're in for. I don't think it's necessarily bad. I do wonder sometimes if they're getting appropriate grade. One of my fears, and I'm going to just say it straight up, this is maybe irrational, but I have a slightly irrational fear of prions and mad cow disease. Say mad cow. And I worry a little bit about animal products like this. These are cow products. If they're not refined or taken care of in the correct way, is it possible that cow brain could get mixed in? Is it possible? I don't know. And I don't say that to be inflammatory, but I will say that there's a brand of moisturizers that's been on the market that used a cow brain derived ceramide for a long time. And then they switched out. Now it's phytoceramides from plants. And I don't know, but I think that was part of the concern, that this sort of is an animal source that we have to be a little careful of. That being said, I think it is fine. It probably just is not a sufficient moisturizer by itself. So some of the patients who insist on it, I'm like, no problem, but let's add something to protect it.
Yeah, I agree 100%. I probably wouldn't choose beef tallow when we have a lot of other good lipid-rich moisturizers. But one of the things I think patients ought to know is just because it's available for purchase doesn't mean that there's any regulation around the way it's made. So you spoke to the purification process and things that we hold certain treatments or certain companies perhaps even hold themselves to their own self-regulating standards that are high-end, cosmeceutical companies, L'Oreal or Galderma, or those that have been on the market for a long while, providing multiple different topical therapies to treat our patients that struggle with barrier, say, and lipid abnormalities in the skin, fat abnormalities in the skin. The lack of regulation in this particular part of the industry is frightening.
You bring up a beautiful point, and this is so important because, we can hate on the FDA, right? The Food and Drug Administration, and I'm guilty.
They make our lives
hard. These
hard.
guys are making it right. Why don't they soften up? But the whole purpose of it was really to help protect people, because in a purely capitalistic market, if you don't regulate at all, then the way we learn some stuff is by hurting people and killing people. And we said, we don't want to do that. Let's make some regulations, right? That's the big idea. So when you go outside of that space, and everything we're talking about is by definition not FDA regulated or approved,
Fringes.
You're in the Wild West.
Yeah, no, 100%. Yeah. Thank you for that. So
other things that can hurt patients.
Exactly.
I was going to say two other major categories. So you kind of brought up one that I think is really important, and that's dietary, extreme dietary stuff. And I think not so much malnutrition, which is scary, but really rare, but much more commonly now what we're seeing is patients who try exclusion diets for certain foods. And Anne-Marie Singh, a wonderful allergist of Wisconsin, did this beautiful paper a couple of years ago where she had patients who were not allergic to foods, okay? They were eating these foods, but they thought, well, maybe this is causing my eczema. So they cut the foods out. Again, something that is not crazy. We used to do this all the time, but after reading this paper, I'm like, maybe we shouldn't. And a percentage of them, it was about 20%, when they added the foods, because they decided, okay, the foods, my eczema is not much better. It really didn't matter. I'm going to go ahead and eat my dairy again. I'm going to have a piece of pizza, whatever it is. But some percentage of them, about 20%, now became really allergic.
Exactly.
Like urticaria, like hives, anaphylaxis, angioedema, which is really scary.
Oh, yeah. No, and I remember the publication and actually thinking to myself the same thing. Holy cow. I wouldn't have suggested a food elimination to patients. But again, I'm happy to walk the journey with them. And if they think that dairy is their problem, I'll say, okay, well, we can try it for a few weeks and see what happens. I'm very hesitant to make that recommendation anymore. If there isn't a true and relatable association that we can defend, there is a potential risk of reintroduction down the road and having a much more significant problem. When we say urticaria and angioedema, we mean hives and lip swelling, tongue swelling, the inability to breathe. I mean, this is what people carry an EpiPen for. So that
your worst fear became realized, right? You were afraid that this was allergy. Now you've really got the allergy.
Yeah, exactly. Exactly.
And I talked to patients about it. Ruchi Gupta, who's a pediatrician and an allergy expert in Chicago, she came up with this very clever quote: "Through the skin, allergy begins. Through the diet, they stay quiet. Meaning we want to protect our skin barrier because we know, as you were saying earlier, some of those food proteins can get through our broken skin and cause allergy to form. But by eating them, we become tolerant to the foods by eating them. That's why we want to feed kids these foods early on instead of waiting to protect them.
And it wasn't that many years ago that they actually have totally taken a 180, the allergy community, pediatric allergy community, on nut allergens, right? And now they want to slowly integrate nut exposures through the diet in these kids that they know have an actual allergy to desensitize them in some way, really to just get their bodies to accommodate to it in a way that it functions normally as a response rather than so abnormally. All right, so I'm now going to ask you, I know this is the Provocative Podcast for public consumption, but I want you to speak to our dermatology colleagues just briefly. What is one integrative dermatology concept that you wish our dermatology colleagues more fully understood or appreciated?
I think maybe the one that I would take home with me is the language we use to talk about what we're doing. That was the most powerful thing for me when I studied acupuncture. So I did my residency, and then I spent a year with Kiko Matsumoto and David Euler, and I spent another year kind of shadowing them.
You like to study.
I do like to study, right? Yes, all of us. We're all nerds.
We do.
That's why, we spent half our life studying. But it was great because one of the things I learned beyond the actual practice of acupuncture and thinking about the patient that way, but was how to talk to patients. So in conventional Western medicine, we use a lot of very violent terms. We're going to kill that infection. We're going to cut that thing out. We're going to suppress your immune system. It's very violent, belligerent, bellicose stuff. But when you leave that tradition, it's very different in other traditions like acupuncture. We talk about strengthening, rebalancing, tonifying. And I love these ideas. And you watch the patient, they start like sitting up straighter. They start smiling. You're like, we're going to rebalance your microbiome. We're going to help strengthen your skin barrier, as opposed to we're going to blast it and attack it and crush it. And I think you see them kind of shriveling up in the chair. So I like just conveying the ideas of what we're trying to do, our intention, and doing so in a positive way as best we can. Now, sometimes if it is a cancer, I guess you're going to put your energy to cutting it out. But at the same time, you might say, so we are going to target this cancer and kill it, but we're also going to do things to strengthen your body and help you deal with this, because this is going to put you through some stress. So we are going to be here to support you and strengthen and tonify you. I
have always adored you, but maybe in this moment more than ever before, the relationships we are so privileged to have with these patients, I would argue they put their greatest asset in our hands, their health, and they're asking us for help. And I love what you just said, because you're absolutely right. These are words. I consider myself a fairly sensitive person, someone who really appreciates this opportunity to connect with someone and to take them from one place that's, we'll call it an ailment or an illness, into a place that's a better space for them. And yet you're 100% right. I might be using verbiage that's absolutely offensive, off-putting. There are ways to welcome them into this journey and into the conversation that allow them to feel like they're getting somewhere through a pillar of strength, and not necessarily of, being destroyed or anything about them having to be destroyed. I love that. Thank you. That was beautiful. Okay, so I'm going to sort of take it to the end and conclude by just asking you, are there any upcoming projects you have, any thoughts, wisdom, scientific, nuanced, new things you think are coming down the pike that you'd like to share with the audience, or have them looking out for, things to be excited about in the future of integrative dermatology?
Yes, I would say we are in this incredible time, really it's like a time of miracles in terms of how many things are happening at once. And the things that I'm most excited about right now, I'm super interested in this idea of remission. Can we not just get somebody better and keep them better with medicines? Can we get them better and fix them in a way that then we can take off medicines so patients can say, okay, I'm not on that anymore. I'm on a far less dose of that. And I love this idea, and I really believe that we can do this with atopic dermatitis. I've written a couple papers about this, and I'm focused on this, and some of the new treatments are promising this from the beginning, that you'll do it for a while, and then once they're stabilized, barriers stronger, microbiomes rebalanced, nerve endings are settled out, immune system is regulated, we can stop it.
Exactly. Strengthening, reorganizing, balancing, recreating what their steady state is, so that they can live without the interventions.
It's all coming together, right? It's all coming together.
That's so great.
The other piece, I think, I'm very interested in the microbiome, and there's a lot happening with the microbiome. And one of the most interesting things I've seen is that maybe the answer is not just like one or two strains. Maybe we actually have to find a harmonious group of things for an individual, like kind of individualizing this and finding a combination that's going to help restore it. So that is the other area that's fascinating, just to see how complex it is. I remember being in residency and saying, why can't we just take one of the probiotics and open up the capsule and put it in a moisturizer? Wouldn't that work? And now I realize, well, no, it won't, for a million reasons. Like the bacteria that we put in our stomach are actually quite different than the ones that are going to thrive on our skin, and the combination and their interactions and all this stuff. So as I see these new papers coming out, new ideas, I'm just like, wow, this is a lot more complex than we gave it credit for.
And the science of personalized medicine that can evolve from all of this is really, it's incredible. We can potentially in the future contemplate a day where we walk, into an exam room, we're able to swab someone and then decide which cohort of, microbiological, commensurate organisms need to be administered to that particular patient. Yeah. There's so much.
Personalized precision medicine, just what is going on with you specifically, and here's what we're going to do to help restore it.
Yeah. Integrative approaches to medical dermatology. Thank you so, so much, Dr. Peter Leo. I couldn't have had a better conversation with you. So appreciate your time. Thank you for joining us.
Thank you so much for having me. This is wonderful.